Hello, my name is Jonathan Lucas. I'm a consultant paediatric spinal surgeon at the Evelina London Children's Hospital and also at the Portland Hospital for Women and Children. The reason I became a paediatric spinal surgeon is an evolution. My training in the 90s was in general orthopedic surgery with a special interest in both adult and paediatric spinal surgery with fellowships at the Queen's Medical Centre in Nottingham and with a British Orthopaedic Association travelling fellowship to the United States. And my first 20 years as a consultant were both in adults and paediatrics. But my interest has developed systematically through that period into the love of treating and looking after children and young people with spinal deformity, because you take children and young people with a deformity, and with appropriate management, you are able to correct this and really transform their life. And also, it's an ongoing thing in that what you do in their childhood has to and will influence how they are throughout adult life and the rest of their life. And with the increasing demands for the type of surgery that we are able to do, with the advancements of surgical techniques and how we are able to treat these young people so much better than we used to be, my interest has developed progressively more and more into looking after children, such that my entire practice, both within the NHS at the Evelina London Children's Hospital at Guy's and St Thomas's and here in the Portland, is dedicated to looking after children and young people with paediatric deformities. Most rewarding aspects of being a paediatric spinal surgeon is a number of aspects. The children and young people come to you with a spinal deformity that's very anxious making, and you are able to define for them what the issues are. You can reassure them, and you can also give them a very clear management plan of what may or does need to be done. And with that, it's reassuring. And then secondly, if you do need to intervene, you're able to change their life by correcting the spinal deformity for the rest of their life. And you follow them up. And that of itself is exciting and rewarding as they grow up, as you grow older, me in this instance. And that is a very thrilling part of the job. So when patients come to see me, the first thing that will happen is that we'll have a consultation. So I'll meet them with their parents and or grandparents sometimes. So I'll go through with them what they think the issues are. I take a history. They'll then have an examination, so they'll have to get undressed with a gown on. There's usually a nurse present. So I'm able to examine the spine and both their upper and lower limbs to make sure all the nerves are working. They'll almost certainly have an X-ray, and the X-ray can be done at the time of the consultation. We have EOS, which is a very low radiation dose of X-ray with very good quality. So they have that, and then they'll see me immediately afterwards. And with that and the clinical examination and history, I'm able to go through what the deformity is and what, if anything, needs to be done about it. And then we construct a management plan together of what needs to be done.